The general case content is next. Certain sections, such as the pre-op diagnosis, may pull in from scheduling or other documentation. Verify that the ASA and wound classes are filled out, which comes from anesthesia. You will need to return to this segment at the end of the case to enter in the post-op diagnosis. Selecting Next will move you on to the Delays segment. When a case begins after the defined start time, the reason will need to be charted in the Delays segment. This section is mainly used for the first case of the day. After filling out all information, selecting Add will complete the process. You can choose to discontinue this or any other segment if they do not apply to your case by right-clicking on the title of the segment and choosing Discontinue. This will gray out the choice and it will no longer be available to chart within. To undo this action, follow the same steps and then choose Activate. By choosing Next, you will move on to the next segment. Here is where you will chart your assessment of the patient's skin. Please note the Outcome Met section. This can be seen in various segments and refers to the AORN standard for that particular segment. These items must be answered. Choose Next to save and move on to the following segment. The Catheters, Drains, and Tubes segment is where you are to document any insertion or removal of items during the procedure, such as a Foley catheter. Document the appropriate information in the same manner as in previous segments. Be sure to chart if the outcome was met. Chart any additional tubes or drains by selecting the Add option and filling out the necessary information. Remember to chart if the outcome was met or not met for each item. It is important to note that this information does not flow to PACU, so you must give a verbal report. There are times when the perioperative RN must place orders in the chart. Some examples include when inserting or removing a Foley catheter or when placing a wound vac. To place an order, simply select the plus sign on the Orders tab. Type in the desired order item in the search field and then click on the magnifying glass on the right. After choosing the appropriate item from the list of choices, a new window will open, allowing you to enter in the appropriate order details and provider information. The provider is required to co-sign these orders. Selecting OK and then Done will return you to the main orders screen. After you have reviewed your order, selecting Sign and then Refresh will complete the ordering process. To return to the intraoperative record, select the perioperative doc from your menu options. Within the Patient Positioning segment, you will chart the position of the patient for the procedure and the use of any devices. Remember to chart the outcome of the patient on the next page. The Skin Prep segment is where you will document the type of skin prep agent used, who performed the prep, and what area was prepped for the procedure. The documentation of any hair removal will also be done within this segment. Again, be sure to document that this outcome was met on the following page. By choosing Add and Next, your data is saved and the cautery segment opens. This segment is to chart the type of cautery used, the settings, and grounding pad information. Again, remember to chart whether the outcome was met or not met on the following page. Use the Add button to document each additional machine. You will need to fill out all the appropriate fields and the outcome for each new entry. When all items are documented, choose Add and then Next to navigate to the Tourniquet section. You can select the type of tourniquet used and the placement information, such as who applied and removed the tourniquet. Remember to enter in the total tourniquet time and document if the outcome was met or not met. The next segment is Patient Care Devices. Patient care devices are items such as the Bear Hugger and the SCDs. These need to be recorded for skip measures. These items are available through a drop-down box under Equipment Type. You must record placement information, settings, and outcomes. To document the use of more than one patient care device, select the Add button. Follow the same steps to document the details for each item. After selecting Add and Next, you will move to the Counts Verification segment. Counts are performed throughout the case to prevent unintentional items from being left in the patient. This segment is used to document the initial and final counts and the personnel that performed each count. When documenting the final count, you will also need to document if the final count was correct. If the final count is incorrect, you will need to follow OR and hospital protocol. If your counts are not correct, or you have additional counts, you will need to add a segment. To do this, open the folder at the top of the document, which opens a new window. All available segments are displayed in the column on the left. All selected segments are shown on the right. To add or remove segments, simply select the item and use the arrows to move them between the two columns. After making your changes, selecting OK will return you to the previous screen. The segment titled Counts Action Taken is used when an X-ray is performed for instrument counts verification after the closure of an operative area or when a count is incorrect. This documentation is needed to confirm whether policy was followed and if the surgeon was notified in the event the counts were incorrect. Fill in all fields and be sure to document that additional actions were taken when the count was incorrect. By choosing Add and Next, you are saving your documentation and moving on to the next segment. Documentation of additional counts should occur when there is a closure performed within a cavity and when you perform staff or shift change counts. When documenting additional counts, remember to select the Add button between each entry before selecting Next. Please note that the outcome met should only be documented during the final count.